Welcome and thank you for joining us today. I am Nicola Staples with the Strategic Outreach Team in the Office of Health Communication and Education at FDA Center for Tobacco Products, also referred to as CTP. Our Strategic Outreach Team is responsible for building and maintaining mutually beneficial relationships with a range of diverse stakeholders to promote awareness of CTP's regulatory activities and tobacco use prevention efforts. Our discussion today is about FDA's planned menthol and flavored tobacco product standards and our rulemaking process in general. Before we begin, I will go over the agenda and our lineup of speakers. Kathy Crosby will begin our presentation. She is the Director of the Office of Health Communication and Education at CTP. She will provide an overview of FDA's plans to advance 2 tobacco product standards, one to prohibit menthol as a characterizing flavor in cigarettes, and one to prohibit all characterizing flavors except tobacco and cigars. Kathy will also begin a discussion about why these product standards matter to public health. Next, Rear Admiral Richarde Araujo, FDA's Associate Commissioner for Minority Health and the Director of FDA's Office of Minority Health and Health Equity, will pick up the conversation and address how the proposed tobacco product standards will help promote health equity. Then, you will hear from May Nelson, the Director of the Office of Regulations at CTP. May will discuss FDA's rulemaking process and how stakeholders can participate. Last, Shanetta Jones, a Supervisory Health Communication Specialist with the Office of Health Communication and Education at CTP, will highlight available cessation resources and tools. Then we will conclude with a question and answer session. Our speakers will respond to the most common questions we received from you before this webinar. We know this is an ambitious agenda with limited time. Therefore, we will not be taking any new questions during this call. If you have any questions that are not covered today, please feel free to email us at asktp@fda.hhs.gov. We will share that email address again at the end of the meeting. Also, a recording and transcripts of today's webinar will be posted to our website in a few weeks. Now with that, let me introduce our first speaker, Kathy Crosby. Kathy has been with CTP since 2011, and her office, the Office of Health Communication and Education, conducts public education, research and evaluation, stakeholder outreach, and regulatory communications to ensure FDA success in implementing the Tobacco Control Act. These efforts include developing innovative communication strategies to help reduce and eliminate youth tobacco use and identifying and engaging with stakeholders to help them better understand FDA's tobacco regulatory process and actions. And last point, we're here today. That's why we're here. Now I will turn it over to Kathy.
Great. Thank you so much, Nicola, for the introduction. Good afternoon, everybody. We're very, very happy you've joined us. I'm going to begin today's webinar with background information about CTP and our Product Standard Authority. As many of you know, to protect the public health and create a much healthier future for Americans, particularly youth, Congress passed the Tobacco Control Act, which was signed into law on June 22nd, 2009. The law gives FDA the authority to regulate tobacco products, and as an agency, FDA's goal is to reduce the harm from regulated tobacco products across the entire U.S. population. This means reducing the number of people who start using tobacco products, encouraging more people to stop using these products, and reducing the adverse health impact for those who continue to use these products. CTP is unique among our fellow FDA centers in that the product we regulate, tobacco, is the only consumer product regulated by FDA that can cause disease and death when used as intended. That is why Congress created a new regulatory standard in the Tobacco Control Act, one that is geared towards reducing the public health toll that tobacco poses to all Americans, not just individual users. In other words, when we take regulatory actions, we consider how they will affect people who currently use tobacco products, as well as people who do not use any tobacco products. So instead of the usual FDA standard of approving safe and effective products, FDA regulates tobacco products based on a public health standard that considers the risks and the benefits of the tobacco product on the population as a whole. For example, FDA's proposed product standard to prohibit menthol as a characterizing flavor in cigarettes is intended to help current users stop smoking combusted cigarettes and prevent new users, especially youth, from initiating use. FDA's ability to enact science-based regulation has the potential to reduce disease and death from tobacco products. To give you a sense for the breadth of CTP's responsibilities, I want to highlight some of the Tobacco Control Act's authorities. I won't run through the whole list, but the Tobacco Control Act gives us the regulatory tools to protect public health by reviewing pre-market applications for new and modified risk tobacco products, requiring new warning labels, establishing and enforcing advertising and promotion restrictions, educating the public about the dangers of tobacco use, and of course, adopting product standards. So let's talk for a minute about FDA's authority to issue tobacco product standards that are appropriate for the protection of public health. A product standard is a rule that sets requirements for a tobacco product. They allow FDA to take specific actions that limit the toxicity, appeal, and addictiveness of tobacco products. For example, the proposed product standards we are talking about today would prohibit menthol as a characterizing flavor in cigarettes and all characterizing flavors except tobacco in cigars. It's important to note that when the Tobacco Control Act was passed in 2009, it granted broad discretion as to the content of a tobacco product standard, if adopting one would be appropriate for the protection of public health. It also established special rule for cigarettes. This special rule prohibits cigarettes with characterizing flavors other than tobacco and menthol. While the rule did not ban menthol as a characterizing flavor in cigarettes, the special rule for cigarettes does not limit FDA's authority to act on menthol or any other artificial or natural flavor, herb, or spice not specified in the special rule. Now, I would like to share some background information about how FDA reached its decision to announce the two tobacco product standards last April. FDA has engaged in close study and careful consideration of the scientific evidence and complex policy issues related to menthol cigarettes. Back in 2010, FDA's Tobacco Product Scientific Advisory Committee, otherwise known as TPSAC, reviewed available evidence concerning menthol in cigarettes and then issued a report in 2011. In developing the report, TPSAC solicited and received input from many public commenters, including researchers, tobacco industry representatives, consultants to the tobacco industry, and public health experts. In the report, TPSAC concluded that removing menthol cigarettes from the market would benefit the public health, but stated that it noted gaps in understanding of menthol cigarettes and public health that should be addressed with further research. Then in 2013, FDA issued an Advance Notice of Proposed Rulemaking, or ANPRM, to gather information related to the potential regulation of menthol in cigarettes, including any data, research, or other information that may inform regulatory actions FDA might take with respect to menthol in cigarettes. Additionally, experts within CTP conducted an evaluation which was posted as part of the 2013 ANPRM's public commenting docket of the available science related to the impact of the use of menthol in cigarettes in public health. In March 2018, FDA issued an ANPRM on flavors in tobacco products, specifically noting the agency's interest in new information related to menthol in cigarettes. I will note that throughout all these years, FDA has also funded research projects on flavors in tobacco products and menthol cigarettes internally within the agency, as well as through external projects, including the Population Assessment on Tobacco and Health, otherwise known as the PATH study, and the Tobacco Centers for Regulatory Science. Previously, the Tobacco Control Legal Consortium, now known as Public Health Law Center, and other individuals and public health groups filed a citizens petition requesting FDA to prohibit menthol in cigarettes. In 2020, a lawsuit was filed by a petitioner alleging that FDA unreasonably delayed issuing a final response to the petition. Last April, we granted the citizens' petition requesting that the agency pursue rulemaking to prohibit menthol in cigarettes, affirming our commitment to proposing such a product standard. I share all these examples to outline some of the critical steps we have taken to help inform our decision to move forward with proposed regulation to prohibit menthol as a characterizing flavor in cigarettes and characterizing flavors except tobacco in cigars. Our decision is based on clear science and evidence establishing the addictiveness and harm of these products. So that brings us to our announcement last spring. On April 29th, 2021, FDA announced the agency's plan to move forward with 2 tobacco product standards to significantly reduce disease and death attributable to using combusted tobacco products. This spring, FDA aims to issue proposed rules to prohibit menthol as a characterizing flavor in cigarettes and to prohibit all characterizing flavors except tobacco in cigars. These actions represent powerful, science-based approaches that will have a significant impact on public health, including helping to significantly reduce youth initiation and addressing tobacco-related health disparities. Let's start by talking about how menthol and flavors can contribute to youth initiation, experimentation, and ultimately addiction. A characterizing flavor of menthol in cigarettes influences use patterns, leading to more youth initiation, progression to regular smoking, and difficulty quitting. Research shows characterizing flavors in tobacco products, including menthol, enhance taste and make them easier to use. Menthol masks the harshness and irritation of tobacco smoke and reduces initial aversive responses to smoking, particularly for young people. Menthol increases product appeal and facilitates repeated experimentation and progression to regular smoking, particularly among youth and young adults. Once a user is addicted, menthol makes it harder for existing smokers to quit. Research shows that youth who initiate smoking with menthol cigarettes, compared with youth who initiate with non-menthol cigarettes, are at greater risk of progression from experimentation to established smoking and nicotine dependence. Similarly, research shows that young adults whose first cigarette was smoked was menthol were more likely to report currently smoking compared to those whose first cigarette was not menthol. Menthol in cigarettes enhances nicotine addiction through a combination of its flavor and sensory effects and interaction with nicotine in the brain. Youth who smoke menthol cigarettes exhibit greater signs of nicotine dependence than non-menthol smokers. As for flavored, mass-produced cigars and cigarillos, they are disproportionately popular among youth. Flavors in cigars increase appeal and make them easier to use. As we noted in April 2021, among youth ages 12 to 17 who use cigars, nearly 74% say they smoke cigars because they come in flavors they enjoy. Among youth who have ever tried a cigar, 68% of cigarillo users and 56% of filtered cigar users report that their first cigar was a flavored product. And in 2019, more young people tried a cigar for the first time every day than they tried a cigarette. Furthermore, flavored mass-produced cigars and cigarillos closely resemble cigarettes. This raises concerns because after the 2009 ban on flavored cigarettes, use of flavored cigars increased dramatically, suggesting that the public health goals of the flavor ban in cigarettes may have been undermined by continued availability of these flavored products. It's with these troubling numbers and the potential to address them with one of the most powerful tools in our regulatory toolbox that FDA is moving forward with proposing these actions. The potential that prohibiting menthol in cigarettes and flavors in cigars will help reduce the likelihood that youth and young adults experiment with these products or progress from experimentation to regular cigarette or cigar smoking is an important public health goal worth pursuing. What's more, our upcoming proposed rules will help us take critical steps to reduce tobacco-related health disparities and to promote health equity by addressing a significant and disparate source of harm. To talk more about the potential where these for these significant public health gains, I will now turn the mic over to Rear Admiral Sharday Arrojo, FDA's Associate Commissioner for Minority Health and Director of FDA's Office of Minority Health and Health Equity. Thanks so much.
Thanks, Kathy, and thanks to everyone for joining us today. In FDA's Office of Minority Health and Health Equity, we aim to promote and protect the health of diverse populations through research and communication of regulatory science that addresses health disparities. Our office works hand in hand with FDA centers and offices, such as CTP, to address health disparities and ensure equity is a goal that FDA continues to prioritize throughout all of our work. So I am pleased to be part of today's discussion about FDA's product standards to prohibit menthol as a characterizing flavor in cigarettes and prohibiting all characterizing flavors except tobacco and cigars. Because we cannot talk about menthol cigarettes and flavored cigars without talking about health disparities. We have made significant progress over the past 55 years in encouraging people to stop smoking. But the reality is that not everyone has been included in that progress. For far too long, certain populations, including communities of color, low-income populations, and LGBTQ+ individuals, have been disproportionately impacted by tobacco use. When we look at menthol, we know that an estimated 18.6 million people currently smoke menthol cigarettes in the United States. But menthol cigarette use is not the same across different communities. Nearly 85% of all Black or African American smokers use menthol cigarettes, compared with just 30% of white smokers. In the United States, significantly fewer African American smokers report long-term quitting compared with non-Hispanic white smokers. Furthermore, African American smokers are more likely to die of tobacco-related disease than white smokers. And while we saw declines in menthol cigarette use among non-Hispanic white youth between 2011 and 2018, we did not see the same decline in use among non-Hispanic Black or Hispanic Latino youth. As for cigar use, data suggests that flavored cigars are disproportionately popular among youth, young adults, and communities of color. For example, in 2020, non-Hispanic Black high school students reported past 30-day cigar smoking at levels twice as high as their non-Hispanic white counterparts. And some research indicates that among past 30-day cigar users, Hispanic Latino, African American, and Asian young adults have greater odds of using flavored cigars compared to their non-Hispanic white peers. As for adults, in an analysis of 2002 to 2016 data from the National Survey on Drug Use and Health, non-Hispanic Black individuals were significantly more likely than all other racial and ethnic groups to have used cigars in the past 30 days. Decreases in prevalence of cigar use have not been observed in Black non-Hispanic adults like they have for other racial and ethnic groups. A more recent National Survey on Drug Use and Health data shows the prevalence of past 30-day cigar smoking remaining significantly higher among non-Hispanic Blacks compared to non-Hispanic whites through 2019. FDA has strong evidence that the planned product standards could achieve meaningful public health gains and advance health equity. Menthol cigarette smokers are less likely to successfully quit smoking than non-menthol smokers, particularly among Black or African American smokers. One recently updated modeling study estimates that prohibiting menthol in cigarettes and cigars could prevent 650,000 premature tobacco-related deaths and reduce life years lost by 11 million over a 40-year period. Taken together, these policies have the potential to save lives and improve the public health of our country, as tobacco use remains the leading cause of preventable disease and death. Thank you. You will next hear from May Nelson, the Director of the Office of Regulations at FDA Center for Tobacco Products. May's team is responsible for developing regulations and guidance documents for CTP. May will talk about FDA's commitment to evidence-based regulations, how the rulemaking process works, and how you can participate.
Thank you, Rear Admiral Arrojo. Hi, everyone. I am thrilled to have the opportunity to speak with you about FDA's rulemaking process and how you can get involved. Currently, my team is leading the effort to draft 2 proposed rules for prohibiting menthol as a characterizing flavor in cigarettes and characterizing flavors except tobacco in cigars. We collaborate with offices across CTP, FDA, and HHS when developing these types of documents. Regulations are one of FDA's critical tools to achieve its public health mission. But one of the first questions many of our stakeholders ask is, what is a regulation or rule? Regulations or rules must be followed like laws and may be described as having the same force and effect as a law. CTP's regulations are based on the laws set forth in the Tobacco Control Act and the Food, Drug, and Cosmetic Act. It is also important to note that the rules are one way FDA communicates what the regulated industry must do to comply with the law, and they specify the details and requirements that are necessary to implement and enforce specific legislation under FDA's general authority. Rules establish regulatory requirements. In some instances, FDA is required by the Food, Drug, and Cosmetic Act to issue rules before FDA can impose certain requirements, such as product standards. Now let's talk about how we develop regulations or rules. When aiming to issue new or revised regulations, FDA typically starts by developing a notice of proposed rulemaking. However, sometimes when FDA is considering potential regulatory action, we first publish an advance notice of proposed rulemaking, which we refer to as an ANPRM, as was done for menthol and flavors. I do want to note that not all ANPRMs will result in rulemaking. An advance notice of proposed rulemaking can help FDA get clarity on certain issues, giving us a chance to collect information, data, and feedback from the public, industry, and stakeholders. For example, to gather information related to regulating menthol in cigarettes, we issued an ANPRM in 2013 asking for relevant data, research, or other information that could help inform our potential regulatory actions. And as a result, we received more than 174,000 comments. Then in 2018, we published an additional ANPRM related to regulating flavors, including menthol, in tobacco products. For this one, we received more than 525,000 comments. Now, once we determine that we'd like to move forward with a proposed rule, there are many steps before it is made public. We typically develop rules, including any necessary analyses, such as a regulatory impact analysis, by forming a work group consisting of subject matter experts from different program offices across CTP and FDA. A regulatory impact analysis considers the economic effects of the rule, including the costs and benefits. Once a rule is drafted, it undergoes review at different offices at FDA, HHS, and the Office of Management and Budget. And once we have gone through all of those rounds of review, FDA publishes the Notice of Proposed Rulemaking in the Federal Register. Now, when we publish a proposed rule, we invite the public to share their feedback on what they think of the rule and what they think it should look like. Every proposed rule has a comment period, which is usually about 60 days. The comment process is an essential part of any rule we develop, and we will talk more about this in a minute. But the bottom line is that hearing from our stakeholders gives us the chance to make the rule stronger, and it enhances our understanding of the issues and helps us determine the best solution to a problem. We may get anywhere from a handful to hundreds of thousands of comments, so it can be a lengthy process for us to review and address comments. In fact, the Administrative Procedure Act requires us to consider all relevant comments on a proposed rule and respond to those comments in the final rule. Public comments have the potential to improve our rules, and they are the best way for you to make sure we hear your perspective. Now, once we have finished considering comments and decide to finalize a rule, we may update and make changes to the rule and related analyses, such as the regulatory impact analysis. It then goes through a similar review and clearance process as the proposed rule before it is published in the Federal Register. So who can submit comments? Now that you know how the rulemaking process works, I will talk about the opportunity to provide comments. As I mentioned, comments help us develop the best possible rules. So FDA welcomes comments from anyone who wants to participate. So if you are wondering whether you can submit a comment, the answer is yes. Anyone can submit comments. But I will share some common examples of those who might comment on a proposed CTP rule. For example, we might receive comments from industry and firms that may be affected by the proposed regulation, or organizations that work on issues related to the implementation of the Tobacco Control Act. And then we may get comments from consumers who want to address an issue in the rule. Now, when it comes to submitting a comment, it is important to remember that FDA regulatory decisions are based on law and science. As our reviewers evaluate comments, they are looking for those that have logic and are supported by studies, data, and other information. A constructive, information-rich comment that clearly communicates and supports its claims is more likely to have an impact on regulatory decision-making than a comment that simply states its support or dissent for a particular issue or proposed rule. Now, regulations.gov has a fact sheet with tips for submitting comments. And while I will go over some highlights now, I recommend all those interested in submitting comments to review the tips carefully. The link to the fact sheet is included at the bottom of this slide. So before you start writing your comment, be sure to read and understand the proposed rule. Aim to include only necessary information and be sure to support your claims. While it is good to be concise, there is no minimum or maximum length for a comment. You should base your justification on sound reasoning and scientific evidence. Our reviewers are looking to see if your comments are supported with substantive data, facts, and/or expert opinions. You can also consider including how you will be affected by the rule, whether it's negative or positive. Include the pros and cons and trade-offs of your position and explain them. For example, you might consider other points of view and respond to them in your comment with facts and sound reasoning. And finally, the comment process is not a vote. A substantive comment that is well supported may have more influence than thousands of standard form letters that do not provide new information. So when and how do you submit comments? FDA will begin accepting comments once the proposed rules are published in the Federal Register and posted on regulations.gov. The Federal Register notice will provide instructions on how to submit your comment. The most common way is to submit them electronically on regulations.gov. The comment period is usually about 60 days, but the timeframe will be specified in the Federal Register notice so that stakeholders clearly know when comments are due. To make sure you are in the know, sign up for our newsletters at the CTP newsroom. Please see the URL at the bottom of this slide. So once the proposed rules are available, I encourage you to start on your comments as soon as possible because comments will not be accepted after the comment period closes. I want to emphasize that these actions are at the top of this administration's tobacco regulatory priorities. Now, to wrap up my section, I would like to mention two broad areas of concern we are hearing from some of the stakeholders about the planned rules. First, we know there are concerns about how the rules would be enforced by local law enforcement. FDA understands that this is a critical and understandably sensitive issue as our society confronts matters related to systemic racism and social justice. FDA's enforcement of any prohibition on menthol cigarettes and flavored cigars, other than tobacco flavor, would only address manufacturers, distributors, wholesalers, importers, and retailers. FDA cannot and will not enforce against individual consumer possession or use of menthol cigarettes or any tobacco product. We will work to make sure that any unlawful tobacco products do not make their way onto the market in the first place. The second concern is about available cessation assistance for current users of menthol cigarettes and flavored cigars. We recognize the importance of ensuring broad and equitable access to all of the tools and resources that can help currently addicted smokers seeking to quit. And to talk more about available cessation resources and tools, I'd like to introduce our final speaker, Shanetta Jones. Shanetta is a supervisory health communication specialist within the Office of Health Communications and Education, and she leads the office's public education efforts focused on harm reduction and cessation. And here is Shanetta. Thank you.
As Rear Admiral Arrojo noted earlier, while we have made significant progress in smoking cessation, certain populations, including communities of color, low-income populations, and LGBTQ+ individuals, continue to experience tobacco-related health disparities. FDA's mission is to use our regulatory tools to promote public health. So one of our goals is to issue rules to regulate the products and provide resources to help people quit and improve their health. The proposed product standards provide an important opportunity for FDA to continue to promote smoking cessation, particularly among those communities of color, low-income populations, young adults, and LGBTQ+ individuals who are disproportionately impacted by tobacco use. Therefore, I will spend the next few minutes talking about cessation resources and tools. While FDA does not currently have menthol or flavor-specific cessation education resources, I will highlight what's currently available to support your cessation efforts in your local communities, and also briefly share our plans to develop messaging for priority audiences who will be most impacted if menthol cigarettes are removed from the market. Let me first start by sharing examples of what's currently available to help smokers who are trying to quit. There are FDA-approved medications that are available by prescription and over-the-counter, including nicotine-based and non-nicotine products. FDA also recently approved the first ever device using transcranial magnetic stimulation, deep TMS, as an aid for short-term cessation in adults. I will next mention that the National Cancer Institute, or NCI, has an extensive suite of free quitting services available at smokefree.gov for a variety of audiences, including teens, women, veterans, Spanish-speaking adults, and older adults. Smokefree.gov also offers a range of quitting tools, including text message programs, a mobile quitting app, and trained cessation counselors. Additionally, NCI operates a free quit line, 1-800-QUIT-NOW. Anyone from any state who calls that one toll-free number is connected to the quit line service available in their state. According to NCI, these quit lines provide a variety of services, including brief advice about quitting, individual counseling, information on cessation medications, free or discounted medications, self-help materials, and referrals to other cessation resources. Additionally, the Centers for Disease Control and Prevention is an important resource for quitting and provides vital information on best practices, insurance coverage, and health systems to state tobacco control programs. And of course, when we talk about CDC, it's hard not to mention their public education campaign, Tips for Former Smokers, or TIPS. It's been 10 years since the campaign first started inspiring people to quit smoking. Next, I would like to highlight FDA's Tobacco Education Resource Library, formerly known as the Exchange Lab. For those of you who are unaware, the Tobacco Education Resource Library is an excellent resource for stakeholders. It provides science-based information on a variety of tobacco-related topics, including cessation. It is a free, easy way to find reliable print and web content to help educate your community about the dangers of tobacco use. You can use the Tobacco Education Resource Library to order and download print materials, syndicate website content, and download images and content to share on social media. We're excited to share that in the coming weeks, we will add a new suite of smoking cessation education posters to the Tobacco Education Resource Library. The posters include messaging based on research that shows it often takes smokers multiple quit attempts to achieve long-term cessation. The posters use a positive, motivational tone to really underscore the health benefits of quitting and also to encourage smokers to keep trying until they're able to quit for good. The posters will be available for diverse adult audiences, including LGBTQ+ smokers, and they will also be available in English and Spanish. The posters will send people to everytrycounts.gov, which was developed in collaboration with NCI, and the site features quitting tips, cessation text messaging programs, and online cessation counseling. everytrycounts.gov will also be available in English and Spanish. So here, I'm going to pause on this slide for a moment so that you can see a few sample posters that will be available in English and Spanish. There will be a total of 12 posters in English and 9 posters available in Spanish. Following the launch of the general smoking cessation posters that I just shared, we also plan to add a menthol-specific poster to the suite of resources. We understand the importance of creating menthol-tailored messaging that FDA and our stakeholders can use to reach communities disproportionately affected by menthol cigarette use. And to address this need, we are taking a phased approach. This slide shows you an example of a menthol-specific poster that we're working on now as part of our first phase. Our next phase involves a more in-depth audience research focused on menthol cigarettes. The goal of our research is to learn more about menthol cigarette users and their needs, and the information we gather from that research will inform our future communication strategies regarding the proposed rule to prohibit menthol as a characterizing flavor in cigarettes. This is a research priority for our team, and we look forward to learning more so we can develop strategies that will help motivate people who smoke menthols to quit. As I mentioned earlier, the posters will be available for free on FDA's Tobacco Education Resource Library. Once available, stakeholders will be able to order, download, or print posters as they appear on the Tobacco Education Resource Library. Additionally, we're very excited to be able to offer stakeholders the opportunity to co-brand posters with their organization's logo. If stakeholders are interested in co-branding, they will email their request to FDA at ctpoutreach@fda.hhs.gov. When the posters are available, you will be able to find more information about co-branding the posters on the Tobacco Education Resource Library. We anticipate releasing the posters in the coming weeks, so please stay tuned for updates. And with that, I want to thank everyone for their time, and I will pass it back to Nicola for our Q&A session. Thank you.
Thank you, Shanetta. And thank you for all of our presenters. I want to remind everyone that a recording and transcript of today's webinar will be available on our website in a few weeks. FDA will notify all registered attendees when they are available on the site. Now, we will move into our question and answer session. As you know, we collected questions in advance of the event. Thank you to all who submitted questions. There were many, too many to answer today. So we are responding to the most commonly submitted questions. But before we begin, I want to note that we received questions that we are unable to answer today. For example, we received questions related to specific details about the proposed rule, like how is the FDA defining characterizing flavor? That we are unable to comment on until the proposed rules are published. Additionally, there were questions about potential future product standards. At this time, we cannot speculate on any additional potential regulatory actions nor comment on the potential timing of other possible regulatory actions. But again, thank you for your questions. We appreciate your time. As for the most common questions we will address today, I plan to read each one and then share it with the appropriate speaker. Our first question is for May. What is the full timeline to rule implementation, including the public comment period, anticipated timing of the final publication, and anticipated effective date? May?
Thanks, Nicola. The length of the comment period will be specified in the Federal Register notice that accompanies the proposed rule, and FDA will regularly promote and remind the public about when comments are due. As for the final rule publication and anticipated effective date, unfortunately, we are unable to speculate on that right now. But as with any regulatory action, FDA will first issue a proposed rule, which includes an opportunity for the public to comment. Once comments have been reviewed and considered, FDA will then address the issuance of a final product standard. The public will have an opportunity to comment on all aspects of the proposed rule, including the proposed effective date. And since the question is being asked in the context of these product standards, It should be noted that the Tobacco Control Act specifically states that product standards generally must have an effective date of at least 1 year after the date of its publication, unless FDA determines that an earlier effective date is necessary for the protection of public health.
Thank you, May. Our next question is for you, Rear Admiral Arrojo. How can removing menthol flavored cigarettes from the market help address health disparities and reduce smoking rates in communities of color and others disproportionately affected by tobacco use?
Thanks, Nicola. For far too long, specific populations have been targeted and disproportionately impacted by tobacco use, especially when it comes to characterizing flavors that entice them to start and continue smoking. For example, it's estimated that nearly 18.6 million Americans use menthol cigarettes, but nearly 85% of all non-Hispanic Black smokers smoke menthol cigarettes, compared to 30% of non-Hispanic white smokers who use menthols. Like CTP Director Mitch Zeller said in his recent FDA Voices blog post, we know the important role of flavors in facilitating initiation and addiction, especially for populations with disproportionate use of and harm from these products. We also have seen the benefits of prohibition of other flavored cigarettes. One of the most powerful ways to address these inequities is to advance these two product standards, which are expected to have enormous health benefits to these populations. One recently updated modeling study estimates that prohibiting menthol in cigarettes and cigars could prevent 650,000 premature tobacco-related deaths and reduce life years lost by 11 million over a 40-year period. Together, the product standards are expected to help save hundreds of thousands of lives, with an especially pronounced benefit for certain racial and ethnic populations, low-income populations, and LGBTQ+ individuals.
Thank you. Now back to you, May. How can stakeholders participate in the rulemaking process?
We encourage stakeholders to participate in the rulemaking process by submitting comments. When the proposed rules are published in the Federal Register, all stakeholders are welcome to share their feedback about what they think of the rule and what they think of any final rule should look like. Submitting a comment is the best way for you to make sure we hear your perspective. As discussed during the presentation, when our reviewers evaluate comments, they are looking for those that have logic and are supported by studies, data, and other information. A constructive, information-rich comment that clearly communicates and supports its claims is more likely to have an impact on regulatory decision-making than a comment that simply states its support or dissent for a particular issue or proposed rule.
Thank you, May. Kathy, our next question is for you. What public education campaigns does the FDA have planned to inform the public of this major change to menthol tobacco products and the evidence-based interventions for those who want to quit smoking?
Sure, thanks for the question. As Janetta highlighted in her presentation, FDA is currently developing a new suite of cessation materials designed to encourage smokers to quit. These materials are designed for a wide range of audiences and underscore FDA's commitment to support smokers who want to quit. In light of the proposed product standard, we recognize that in addition to general cessation resources, there may also be a need for tailored public education materials. We are planning additional research to inform future menthol-specific messaging to support those who want to quit smoking menthols. FDA recognizes the importance of ensuring broad and equitable access to all the tools and resources that can help currently addicted smokers seeking to quit, including those who smoke menthol cigarettes and would be impacted by these public health measures. FDA will work with partners and other federal agencies to make sure that the support is there for those who are trying to quit. And smokers interested in quitting today should visit smokefree.gov or call 1-800-QUIT-NOW to learn about cessation services that are available to them in their state right now. Thank you.
Thanks, Kathy. Now we have two more questions for you, May. Will FDA make sure that states and local communities have matching laws to enforce the product standards if implemented?
So as a reminder, the product standards being discussed would only address manufacturers, distributors, wholesalers, importers, and retailers. FDA's regulation of tobacco products is federal in nature, and these product standards would set requirements for those entities throughout the country. Though a city, county, or state could theoretically enact sales and distribution laws regarding flavored cigarettes and cigars that may be more stringent, FDA's regulatory authority is such that it can enforce its product standards throughout the country and does not need additional laws to do so.
Thanks, May. Here's the second one. Is FDA concerned about an illicit market for menthol products?
FDA is aware of concerns that removal of these products from the market may be accompanied by an increase in illicit market versions of these products. FDA will consider any potential adverse effects, including the possibility of an illicit market, when considering a potential product standard. Previously, FDA also announced the availability of a draft concept paper entitled Illicit Trade in Tobacco Products After Implementation of an FDA Product Standard, which sought public comment regarding the potential for illicit trade markets to develop in response to a tobacco product standard. FDA believes that there are significant public health benefits to moving forward with the product standards, which are aimed at reducing initiation, reducing progression to regular smoking, and increasing cessation. And the agency has regulatory tools and enforcement authorities to address tobacco products that are marketed without authorization, that are counterfeit and or are otherwise involved in illicit trade. So for example, FDA can issue warning letters to notify manufacturers of violations and seek voluntary compliance. We can also issue an import alert and refuse admission of tobacco products imported or offered for import into the United States. And we could also initiate seizure or injunction court actions to ensure that these products are removed from the market. The FDA has previously issued letters to companies suspected of marketing counterfeit or otherwise unauthorized products. The agency will continue to use all its enforcement tools to get counterfeit and illicit market products off the market.
Thank you, May. Kathy, here's another one for you. Why aren't e-cigarettes and other electronic nicotine delivery systems included in these actions?
Okay, that's another good question. So each year, more than 480,000 people die in the US prematurely from tobacco-related disease, mainly due to smoking. Specifically, nearly 41 million adults in the US use any combusted tobacco product, including cigarettes and cigars, which are the deadliest tobacco products. The proposed rules FDA will publish this spring are intended to make the largest impact in reducing tobacco-related death and disease by targeting the deadliest tobacco products. At the same time, our commitment to addressing youth use of e-cigarettes and other electronic nicotine delivery systems is unwavering. More than 2 million youth in the US today currently use e-cigarettes. We continue to address these issues through our pre-market review of tobacco product applications, which ensures that each new product that is introduced to the market, for example, is appropriate for the protection of public health. We also have comprehensive compliance and enforcement efforts, and of course, our public education campaigns designed to prevent youth from initiating or using vapes.
Thank you, Kathy. May, you'll wrap up our Q&A session with the final 3 questions. We received a lot of questions asking whether certain types of products, such as roll your own, heat not burn, and very low nicotine cigarettes will be subject to the menthol product standard. FDA can prescribe the specifics.
Thanks, Nicola. I know folks are interested in the specifics, but the rule will describe the proposed scope of the product standard. And we cannot share any other details at this time, but we do look forward to reviewing comments from the public on these proposals.
Next question. What is the estimated economic impact to small businesses and businesses owned by certain racial and ethnic populations if the rules are implemented?
So as part of the rulemaking process, FDA will accept and review comments on the impact of the proposed product standards on the tobacco industry. As I mentioned earlier in my presentation, FDA considers various analyses as part of the rulemaking process, including the economic effects of the rule, such as costs and benefits.
Thank you. And last, if the rules are implemented, would retailers and wholesalers have time to sell through their products?
So at this time, again, FDA cannot discuss the specific provisions of the proposed rules, but this is a topic the agency considered when we implemented the special rule for cigarettes back in 2009. And additionally, once the proposed rules are published, we will accept and review comments related to this topic and others.
Thanks, May. That is our final question. If you have additional questions that were not covered today, please feel free to email us at askctp@fda.hhs.gov. Thank you again for joining us. We appreciate your time and your questions. We hope we were able to provide you with the information you need to participate in our rulemaking process. Again, a recording and transcript of today's webinar will be posted to our website in the coming weeks. Thank you and have a great day. This concludes our webinar.